Antimicrobial resistance in short is called as AMR, and commonly people call it as antibiotic resistance. It comes from three words: anti, microbial and resistance. The various microorganisms like bacteria, viruses, parasites are killed by the antimicrobial medications, and the illnesses caused by these microorganisms are treated by these antimicrobial medications. The antibiotics in general treat the bacterial infections. These microorganisms, due to various causes, evolve and develop an ability to not to be killed by these medications, and the illnesses caused by these microorganisms then are not treated by these medications. Well, the major cause is definitely the overuse and misuse of antibiotics or the antimicrobial medications. When people use or take the antibiotics themselves without prescription, and most of the times do not take the full course of treatment. We do not take the antibiotics directly only, we also get it through the plants and the animal food we eat. These days, the antibiotics or the antimicrobial medications are heavily used in the agriculture and animal husbandry industry, and from these animals and plants we also indirectly get the antibiotics and the antimicrobial resistant microorganisms. Yeah, for sure, it's a global concern. Antimicrobial resistance is happening everywhere. No country is spared by antimicrobial resistance. It is majorly affecting the developing countries as such. The healthcare infrastructure and the finances available are less in comparison to the developed countries. It leads to near about 7 lakh deaths per year already as per various reports, and estimated loss of lives will be around 10 million by 2050. It not only leads to loss of lives, it also leads to financial loss. And as per various reports, the financial loss will be around 100 trillion USD by 2050. Yes, people with weakened immune status, elderly, children, people admitted in the hospitals, undergoing chemotherapy, people living in areas with poor hygiene are all prone to get AMR. From geographic point of view, developing countries like India, due to lack of tighter regulations, the antibiotics are freely available and people use and misuse antibiotics at will, are more prone to get AMR. See, the foremost importance should be put on educating people and the right use of antibiotics. That's where everybody is talking about antibiotic stewardship. That's very important, no doubts there. But I would like to touch upon another factor, which is lack of point of care diagnostics and diagnostics facilities available. And this is where people are forced or eager to get antibiotics and treat it early. And even the doctors are forced to give antibiotics as a blind therapy and give broad spectrum antibiotics without getting it diagnosed. This is where it is very important that the point of care diagnostics and the innovative diagnostics should be encouraged and developed, which can diagnose both the infection and antibiotic susceptibility and resistant in a day or preferably in few hours, so that people do not have to wait for 2 to 5 days as they have to wait with the current diagnostic methods, and they can get early diagnosis and use the right antibiotics or the antimicrobial medications.